The story of St. Patrick's Mental Health Services goes back 270 years. It's a tale that began with the vision of Jonathan Swift, Dean of St. Patrick's Cathedral, noted satirist and patriot, who, upon his death in 1745, left £12,000 to build a house for fools and mad, a generosity of spirit now equivalent to a gift of nearly €2.5 million. Swift was a pioneer in recognizing that people suffering from mental illness required a specialist service to provide care, treatment, and a voice. A former governor of the infamous Bedlam Asylum in London, he understood that there is a thin line between sanity and madness. 1 year after his death, St. Patrick's Hospital was founded, not only the first psychiatric hospital to be built in Ireland, but one of the very first in the world. Swift intended that the cost of care provided at St. Patrick's would be met by the income earned from his estates, but this proved impossible. Within 6 years of the opening of Swift's hospital, the governors were left with no option but to petition Parliament for financial support. Later, fee-paying patients, known as boarders, were admitted along with their own furnishings and servants. This was in grim contrast to the conditions provided for free patients known as paupers, who were housed in unheated basement cells with stone floors. The first century of Swift's hospital did not result in the humane treatment he might have wished for and that we have come to expect. Although patients in St. Patrick's Hospital were undoubtedly cared for in a more humane setting than if they had been confined in the jails and workhouses of the 18th century. Harsh treatment was common, attendants were untrained, and patients were often restrained in straitjackets or with manacles. Swift's gift was to recognise that mental health care is a national necessity. There was more than mockery to his famous verse in which he said of the hospital that no nation needed it so much. His enlightened views on many aspects of health were far ahead of their time. It was he who wrote once that the best doctors in the land are Dr. Diet, Dr. Quiet, and Dr. Merriman. It would take more than a century for the hospital to begin to reclaim its founder's vision of holistic and humane care. Throughout the 19th century, the hospital grew significantly. By 1817, 2 building extensions saw the population rise to over 150 patients. By 1872, staff numbers were in the 50s, and such was the growing need for services that in 1898, St. Edmundsbury in Lucan was acquired. It was Dr. Richard Leeper, appointed medical superintendent in 1898, who was largely responsible for transforming St. Patrick's from an asylum for the maintenance of the mentally ill to a modern hospital for their treatment and cure. By 1938, Dr. Leeper's accomplishments included installing the first clocks for the benefit of patients, the segregation of female and male wards, the abolition of the use of restraints, the establishment of a training scheme for nurses and attendants, plus the construction of day rooms, bathrooms, toilets, and a food lift to the kitchen. Leeper's modern-minded initiatives were embraced by his immediate successor J.N.P. Moore, who finally removed the old prison-like doors on the cells and continually challenged the assumption that all mentally ill patients were a danger to themselves and society and should be locked away. In the century that followed, many people worked together to ensure that St. Patrick's became a noted centre for teaching, research and innovation. The range of therapeutic care expanded in many ways. For example, the first meeting of Alcoholics Anonymous in Europe took place in St. Patrick's, and the hospital was one of the first to establish community services in its locality. 270 years on, St. Patrick's Mental Health Services has become Ireland's leading not-for-profit mental health organisation, with over 700 staff members delivering 12% of the country's total inpatient care and treatment needs. It is a modern, efficient, and growing mental health service with 2 inpatient campuses that offer an array of services for adults with mood disorders, psychosis, addictions, anxiety disorders, and eating disorders. Adolescent mental health services at Willow Grove. Over 25 day service programs. and 7 clinics in the community, providing a network of care accessible to people in every county in Ireland, with over 55,000 appointments since 2009. St. Patrick's Mental Health Services, a long history and proud role in Irish life, driven by a vision of society where all citizens are given the opportunity to live mentally healthy lives.